This is Sharon Straw's head to toe assessment. Oh, and now I'm going to do a whole 360 view. Okay, and then, okay, I think, oh, like this. Oh goodness. Okay, I think that's about as good as it's gonna get. Okay. Okay, knock knock. Hello. Close the door for privacy. My name is Sharon. I'm going to be a nurse. Can you tell me your name and date of birth?
It is Jonathan Collins and 9/23/2000.
Okay. I'm going to do a head to toe assessment on you. I'm going to wash my hands and I'm going to wipe my stethoscope with an alcohol wipe. Can you tell me why you're here?
For a head-to-toe assessment
Okay, can you tell me where you are?
in the bedroom.
And can you tell me what month it is?
July.
Okay, so patient is ANO ×4. He is of large stature. He's dressed appropriately. He is understandable, attentive, and pleasant to be around. And his posture is relaxed. Patient's skin matches genetic background, pink and white for Europeans. And so I'm going to ask you 12 questions. Can you tell me if you are having any chest pain?
No.
Do you have any cardiac history?
No.
And how many pillows do you sleep on? One. Okay. And do you have any swelling in your legs?
No.
Have you noticed any lesions on your skin?
No.
And have you noticed any any discoloration of your skin?
No.
Okay. Are you having any, when was your last bowel movement?
Today.
Okay, good. And do you have any abdominal pain?
No.
And can you swallow?
Yeah.
Okay, that's good. Are you short of breath?
No.
Do you have any pain while you're breathing?
No.
And do you smoke?
No.
Okay, good. All right, so now I'm going to inspect his chest, and his shoulders are symmetrical. I'm going to state everything that's on the right side. So second intercostal space, sternal border is aortic, and now I'm going to state everything that is on the left side. So second intercostal space, sternal border is the pulmonic. Third intercostal space, sternal border is Erb's point. Fifth intercostal space, sternal border is tricuspid, and then midclavicular, fifth intercostal space is the mitral, where you can feel the apical pulse. And then now I'm going to palpate. Okay, and I do not feel his apical pulse, or I do not feel, apical pulse is non-palpable. Now I'm going to auscultate for any rhythms that are different with the diaphragm. Okay. Okay, and I'm going to stay on the mitral for a full minute to assess the rate. And the rate is 64 beats per minute, and it is regular. The rhythm is regular, and all areas were heard for S1 and S2. Now I'm going to listen for any murmurs with the bell side. Okay, no murmurs were detected. So now I am going to check for any jugular vein distension. Okay, so I'm going to have you sit 30 degrees Fowlers like this. I'm going to have you turn your head away from me, and you're going to use your core muscles to bring yourself up. No jugular vein distension. So now I need you to hold your breath because I'm going to palpate for your carotid. Okay, you can breathe. The strength was 2, it was palpable, and it felt regular. So now I'm going to listen for any bruise. I'm going to have you hold your breath again when you're ready. Okay, you can breathe. I used the bell side and no bruises were detected. And now I'm going to assess his skin temperature and texture all the way down to his legs. I'm using the dorsal side of my hands. He feels warm, the skin is smooth, skin turgor is good, perspiration is normal all the way around, all throughout his body, and skin has no lesions. His skin color matches his genetic background. He's symmetrical. And now I am going to assess for your pulses. So I'm going to have you hold your wrist out like this. So I'm going to check his radial pulse at the same time. And I'm going to stay here for a full minute if it's abnormal, and then for 30 seconds if the rhythm is regular. And his beats per minute is 64. His strength is 2, it's regular and symmetrical. Now I'm going to check for ulnar, which is right here. And then I'm going to check for his brachial. Nice. And then this would be his femoral, right here. And then I'm going to check his popliteal. Nice. Now I'm going to check his posterior tibialis. And then I'm going to check his dorsalis pedis. Okay. Everything was, the strength was 2 symmetrically, and the rhythm was regular. So now I am going to check his capillary refills. Oh, turn your hands like this, perfect. Nice. And then I'm going to check his toes. Okay, fingers and toes, capillary refills were brisk within 3 seconds. Now I'm going to check for pitted edema on his shins, and I'm going to hold for all 3 areas 5 seconds. So ankles, no pitted edema there, and his shins, and then his ankles, 5 seconds, no pitted edema there. Hold for 5 seconds on top of the feet, no pitted edema there. Okay, now I'm going to have you turn on your back. I don't have a pillow underneath him. He can put his legs up if he needs to, if his back hurts. So now I'm going to lift up the shirt. Okay, I'm going to just inspect it. His abdomen appears symmetrical, and his skin color matches his genetic background. There's no lesions, there's no sores. Umbilicus is inverted, is midline, and there are no umbilicus hernias. I am going to, now that I've inspected, I am going to auscultate. I'm going to use the diaphragm first, and I'm going to do it in all 4 quadrants, starting the lower right, and then upper right, and then upper left, and then down to the lower left. And then I'm going to switch to the bell side to listen for any bruise 2 inches above the umbilicus. All right. All 4 quadrants, bowel sounds were heard, no bruise detected. Now that I've auscultated, I'm going to percuss. So I'm going to start on the lower right quadrant, and tympani, dull, tympani, dull, tympani, dull, tympani, dull, tympani, dull, tympani, and then dull. Okay. Midline was tympani, sides were dull. Now I'm going to palpate. I'm going to be looking at his face the whole entire time I'm doing it in all 9 quadrants. So we're going to start here. So far, no tenderness. So far, no masses are felt. No organomegaly. Doing okay? Okay. Okay. So no masses felt, no organomegaly. Patient showed no signs of tenderness. Now I am going to have you sit upright in 90 degrees. Okay. Now I am going to look at your posture. Your posture is straight, is relaxed. His shoulders are symmetrical. I am going to, and there are no, upon inspection, for the cardiac, I don't remember if I said this, but upon inspection, there are no lifts, no heaves, and no thrills felt. And thrills felt would be for palpation. Yes. And I'm inspecting symmetrically. His shoulders are symmetrical, and he has no bulges, and he has no retractions. So, now that I've inspected, I am going to palpate. All right, let's start up here. Does this hurt?
No.
No? Okay. Okay. Patient has no crepitus and no tenderness. Now I'm going to, every time I do this, you're just going to say 99.
Okay.
So.
99, 99, 99, 99, 99.
Okay. Tactile firmitus was clear bilaterally. Now I'm going to percuss. So I'm going to start here. Okay. And lung fields are resonant. Now I'm going to auscultate. I'm going to do with my diaphragm. Okay. Every time you breathe in, you're going to breathe in slowly and deeply in your nose, out your mouth. I'm ready when you are. Okay. Lung sounds are clear, unlabored, regular, bilaterally. Yep. Asymmetrical, no lesions. Okay. Posterior side. Oh, I gotta do the anterior posterior ratio now. So I'm gonna do this. Now let's raise this arm up. So 2, then 1. And then I'm gonna have you stand up for me, and we're just gonna turn you around. And let me make sure we can still see you. Oh, yeah, let me scoot this back a little bit. I think that's good enough. Yeah. Here, come back a little bit. Oh, actually go back forward. Go forward. Okay, perfect. Okay. And then 2, you're gonna raise this arm up. 1, okay. Now I'm going to palpate, so I'm going to feel for any tenderness. Does this hurt?
No.
Okay. No tenderness, no crepitus, no bulges, and no retractions are shown, are felt. And I'm going to do this again, and you're going to say 99.
Okay. 99, 99, 99, 99, 99, 99.
Okay. Tactile firmitus is clear symmetrically. Now I am going to percuss. Okay. Lung fields are resonant posterior ratio 2-to-1 as well. Yeah, symmetrical, patient symmetrical, skin matches genetic background, there's no sores, no lesions. Again, there's no bulges or retractions. Now that I percussed, I am going to auscultate. I'm going to have you breathe in your nose and breathe out your mouth deeply and slowly. Perfect. Lung sounds are clear. Lung sounds are clear, unlabored, regular, symmetrically, or bilaterally. And I would inconspicuously look at his respiration rates, which are 12 per minute. And I would do that for 30 seconds. If I thought that he was breathing way too fast or irregularly, I would do it for a full minute. And you kind of see. Thank you for watching.